Welcome to the Deep Dive. Today we're tackling a really interesting one, Dapagliflozin. You might know it as Farxiga. You shared some great sources on this, and what we want to do today is really unpack its journey because it started out, for type 2 diabetes, but has become this, well, much broader thing, a prime example of finding multi-tool solutions in medicine almost by surprise. So we'll trace that path, look at how it works, the weight loss evidence for people with and without diabetes, what users are saying, and, crucially, what you need to consider. Okay, let's dive in. Right, so first things first, before we even get to the weight loss side of things.
Yeah.
What is dapagliflozin? How does it actually function in the body, fundamentally?
Okay, so dapagliflozin, it's part of a class called SGLT2 inhibitors, sodium glucose cotransporter 2 inhibitors. Big name, I know. But what it mainly does is work in your kidneys. It targets and blocks a specific protein there, SGLT2. Normally, this protein, its job is to pull almost all the glucose filtered from your blood back into your bloodstream.
Ah, okay. So it stops that reabsorption.
Exactly. By blocking it, dapagliflozin just lets that excess glucose flow out in the urine. And that's why it's effective at lowering blood sugar levels for people with type 2 diabetes. It basically makes you pee out extra sugar.
Right, that makes perfect sense for blood sugar control. But the weight loss, how does that connect? Is it really just about shedding those sugar calories?
It's a good question. And yeah, it really boils down to two main things, both directly linked to that glucose excretion. First, like you said, caloric excretion. Every gram of glucose has roughly 4 calories.
Okay.
So when this drug helps you excrete, tens, maybe even up to 100 grams or more of glucose a day, that adds up. It creates this consistent, low-level calorie deficit.
So it's like a slow, steady burn happening internally.
Kind of, yeah. It's flushing out maybe 200, 300, sometimes 400 calories a day that would otherwise have stayed. That's the main engine for the gradual, sustained weight loss. Then second, there's something called osmotic diuresis. Basically, more sugar in the urine pulls more water out with it.
Ah, so a water weight component too, especially initially.
Precisely. That contributes to some of the early weight drop people might notice. There could be some, minor indirect effects on appetite maybe from better metabolic health overall. But those two, the calories out and the water out, those are the primary drivers we see.
It's fascinating how tweaking one mechanism, glucose handling, has these knock-on effects.
Yeah.
Does it stop there, or have clinical trials uncovered other sort of ripple effects beyond just the diabetes focus?
Oh, definitely. This is where it gets really interesting and shows its multifaceted nature. Beyond just lowering blood sugar, dapagliflozin now has much broader approvals, big ones. It's approved to reduce the risk of cardiovascular death and hospitalization for heart failure in adults.
Wow, okay.
Yeah, especially in patients with what's called heart failure, with reduced ejection fraction, basically, when the heart isn't pumping as strongly as it should. And crucially, it's also approved to slow down kidney disease progression and reduce CV death and heart failure hospitalizations in adults who already have chronic kidney disease.
So it's really moved way beyond just a diabetes drug. It's protecting the heart and kidneys too.
Exactly. It's a cardiorenal protective agent now, which is a huge deal.
Okay, so the science makes sense. The broader benefits are clear. But let's get to the question lots of people are asking. Does it actually cause noticeable weight loss? And if someone takes it, what kind of results are typical?
Yes, the short answer is absolutely, it does cause weight loss. Clinical trials consistently back this up. We typically see a modest but statistically significant reduction in body weight,
Mocks me.
usually in the range of about 2% to 4% of someone's initial body weight, playing out over several months.
Okay, so for someone, say, 200 pounds, that might be like 4 to 8 pounds.
Exactly, that kind of range. It's important to set expectations. This isn't like some dramatic, rapid weight loss drug. It's a steady, gradual process. But that sustained loss can really help improve health markers. And of course, it's always meant to be an adjunct part of a bigger picture with diet and exercise, not a magic pill on its own.
Right. For people with type 2 diabetes, losing even that modest amount alongside better blood sugar control must feel like a win-win.
Definitely.
But what about using dapagliflozin for weight loss in people without diabetes? You mentioned the heart and kidney benefits extend to them. But is it actually used just for weight loss in that group? Is that like an emerging thing?
That's a really key point. The mechanism for weight loss peeing out calories obviously works, whether you have high blood sugar or not. However, its official explicit approval just for weight management in non-diabetics. That's currently quite limited. It's not its primary approved indication in that population.
I see.
But as you said, the heart failure and chronic kidney disease benefits do apply to people without diabetes. And in those situations, any weight loss is often seen as a welcome side benefit. Using it solely for obesity, without those other underlying conditions, well, that requires more research and specific regulatory green lights.
So that would be considered off-label use right now.
Pretty much, yeah. And any off-label use really needs a thorough conversation with a doctor. You have to weigh the individual's health, potential risks, everything. The standard dose, by the way, where these effects are seen is usually 10 milligrams once a day, taken orally.
Okay. And it's always helpful to hear what people are actually experiencing, outside the formal studies.
Yeah.
What kind of things pop up in patient reviews or forums online about dapagliflozin and weight loss? What's the buzz?
What really stands out, I think, is this sense of quiet satisfaction for many. People often mention the weight loss is consistent, even if it's modest. They talk about feeling less bloated, maybe having a bit more energy. It's not dramatic, like you suddenly drop 20 pounds. But it's that steady, gentle downward trend on the scale that seems to resonate. People often say it feels more sustainable than other things they've tried.
So more of a gradual shift than a sudden drop.
Exactly. Echoing the clinical data, really. People say it happens over weeks and months, and for many using it for diabetes or heart kidney issues, the weight loss is just seen as this fantastic added bonus. Of course, you also see discussions about side effects, how people manage them, and sometimes people talk about taking it alongside other meds like metformin for potentially better results.
That makes sense. And speaking of side effects, that's obviously critical with any medication. What are the main things people should be aware of with dapagliflozin, both common and the more serious, rarer risks?
Right, absolutely crucial. So overall, it's generally well tolerated, but side effects can happen. The most common ones are related to that sugar in the urine. Genital mycotic infections, basically yeast infections, can occur in both men and women because the sugar creates a, favorable environment.
Okay, that's good to know.
Urinary tract infections, UTIs, are also more possible. And people often notice they need to urinate more, especially when they first start. That's the polyuria.
Which could lead to dehydration.
Yes, potentially mild dehydration and increased thirst. It's important to stay hydrated. Then there are less common but more serious things to be aware of: diabetic ketoacidosis, or DKA.
Even with normal blood sugar.
Yes, that's a key point with SGLT2 inhibitors. DKA can happen even if blood sugar isn't super high. It's a medical emergency, involves a buildup of acids in the blood. Rare cases of acute kidney injury have occurred, especially if someone gets dehydrated. Low blood sugar isn't a big risk when used alone, but the risk goes up if you combine it with insulin or certain other diabetes meds like sulfonylureas. And then there's a very, very rare but extremely serious bacterial infection of the area around the genitals. It's called necrotizing fasciitis, or Fournier's gangrene.
Wow, that sounds serious.
It is extremely serious, but thankfully incredibly rare. Still important to know the warning signs. Allergic reactions are also possible, like with any drug. And one more point, elderly patients might be a bit more prone to dehydration and kidney issues, so they often need closer monitoring. Typically, it's taken once a day in the morning, doesn't matter if it's with or without food.
That's a very thorough overview, thank you. Okay, stepping back a bit.
Yeah.
How does dapagliflozin compare? If we look at the wider landscape of weight loss options, or other diabetes drugs that also help with weight, where does it fit in?
Good question. Let's connect it to the broader picture. Compared to another SGLT2 inhibitor, like empagliflozin, you might know it as Jardiance, they're pretty similar. Both show that modest weight loss effect, similar overall efficacy in trials.
Okay, so within its own class, it's comparable. What about against something really common, like metformin?
Right, metformin is often the first drug people try for type 2 diabetes. It can cause some modest weight loss too, maybe around 1 to 3 kilograms, so a few pounds. But it's generally less pronounced than with dapagliflozin, and it works through totally different mechanisms more related to insulin sensitivity and glucose production by the liver. Combining dapagliflozin and metformin is actually quite common and often very effective.
And what about those newer drugs getting a lot of attention for weight loss, like the GLP-1s, semaglutide, liraglutide?
Yes, the GLP-1 receptor agonists. They are definitely known for weight loss, and generally they lead to more substantial weight loss than SGLT2 inhibitors like dapagliflozin. We're talking potentially higher percentages of body weight. But again, different mechanisms. They work more on appetite regulation, slowing stomach emptying. They also have different side effect profiles, different indications, different ways they're administered, often injections.
So there's no single best diabetes drug for weight loss, it sounds like.
Exactly. It really depends on the individual patient, their overall health, their specific goals, what other conditions they have, costs, side effect tolerance. It's a very personalized decision. And just quickly, generic versions, like you might see auro Dapagliflozin, are considered bioequivalent. They should have the same effects as the brand name, Farxiga.
That's really helpful context. Okay, so wrapping this up, what's the main takeaway for our listeners from this deep dive into dapagliflozin? It really strikes me how a drug developed, for one thing, blood sugar, turned out to have these significant heart and kidney protective effects, plus this consistent, albeit modest, weight reduction benefit.
Precisely. It's a great illustration of how sometimes we find these unexpected extra benefits with medications. And while, yes, dapagliflozin does help with weight loss, it's crucial to remember it's that gradual process. It absolutely needs to be seen as part of a healthy lifestyle diet, exercise, the whole picture. And really, for anyone thinking about it, especially if it's mainly for weight management or if you don't have diabetes, that conversation with your doctor is essential. You need to weigh the pros and cons for you, get the dosing right, and understand exactly how it fits into your personal health plan.
Absolutely. And as the research keeps evolving on these SGLT2 inhibitors, dapagliflozin really does stand out. It makes you think, doesn't it? How these multi-benefit drugs might shift how we manage complex conditions down the line, moving away from treating just one symptom.
Towards more holistic solutions, maybe.
Exactly. Towards more integrated, holistic health solutions. Definitely something to mull over as you go about your day.